The anterior pituitary gland is a double-lobed endocrine gland located beneath the hypothalamus. It regulates several physiological processes, including stress, growth, reproduction, and lactation. In this episode of True Life, you are going to hear from 6 young people about why they are obsessed with the anterior pituitary gland.
I'm obsessed with the anterior pituitary gland because it secretes prolactin, which stimulates milk production so I can breastfeed my baby. It also has an effect on the sexual functioning in men, but too little or too much of a good thing can be bad. Hyperprolactemia, or too much prolactin, can cause the spontaneous production of the flow of breast milk, which I'm telling you, you don't want to have happen in the middle of that though. It's a nightmare. It can also cause disruptions in menstruation, meaning periods may become irregular or disappear altogether. Women may also experience breast pain and loss of libido. In men, it can cause hypogonadism, infertility, and erectile dysfunction, as well as gynecomastia. Hypoprolactemia, or too little prolactin, is associated with menstrual disorders, delayed puberty, and inadequate lactation. In men, it can cause erectile dysfunction, premature ejaculation, metabolic syndrome, and anxiety. Low prolactin levels may also cause a reduced immune response to some infections.
Hey, have you ever heard of follicle-stimulating hormone?
No.
Really? Well, it's this hormone, and it's really unlike any other. It's a type of gonadotropin, and that's just because it stimulates the gonads in both men and women. And it comes from the anterior pituitary gland. It's released from cells called gonadotrophs. So when it's released, it secretes this hormone, and it stimulates follicular growth and this hormone called estradiol in the first half of the menstrual cycle. So with this, your ovarian follicles are able to mature. If it does not occur at this time, then your ovaries can't mature, and it could cause you to not ovulate. And then in men, it is regulated by testosterone and inhibin and stimulates the production of sperm from Sertoli cells. So raised levels of this indicate ovary and testes malfunction in men and women, and then low levels could mean incomplete development at puberty and also infertility.
Oof.
Yeah.
Elisa, we're ready for you now.
Well, nice meeting you.
Okay, bye.
Bye.
I know everyone is saying that they love the anterior pituitary gland because of other reasons, but the real reason that it's the best is because it secretes growth hormone. Growth hormone is so fantastic because it promotes growth and allows lipid and carbohydrate metabolism. The hormone targets the liver and adipose tissue. I'm glad that I have the right amount because that means I'm tall and strong. If I had too much growth hormone before puberty, it could have caused an overgrowth of all of my long bones, and then I'd be a giant. If I was a little bit older, like middle-aged, and had too much, it could cause acromegaly, which causes disfigurement and possibly premature death. If I didn't have enough growth hormone, I would be short, and a severe deficiency would make all of my body tissue impaired, and I could have congenital defects and be a dwarf. I'm so glad my hypothalamus told my anterior pituitary to secrete the right amount of growth hormone. The secretion of my growth hormone is affected by a lot of things, like my age, gender, diet, exercise, and stress level. Secretion of growth hormone can be affected by some medications, such as glucocorticosteroids. Replacement therapy is also very limited because it has really severe side effects. I'm so glad that I have just the right amount of growth hormone, and that's why I love the anterior pituitary gland.
Yeah, that's what I said. All right, yeah, I'll call you back later. All right, bye. Ever since age 12, I've been obsessed with the anterior pituitary gland, especially luteinizing hormone, which is made by the gonadotroph cells in the anterior pituitary gland. In males, this hormone stimulates the production of Leydig cells, which in turn produces testosterone. Testosterone stimulates the development of primary sex characteristics in males, such as sex organs and reproductive structures. It also is responsible for the development of secondary sex characteristics at puberty, such as facial and body hair, muscle development, and a deeper voice. In an adult, testosterone is responsible for maintaining secondary sex characteristics and stimulates spermatogenesis. In females, luteinizing hormone triggers ovulation. Therefore, without luteinizing hormone, none of us would be here. Incredible, huh? However, when there's not enough luteinizing hormone, it can cause a low sperm count in men and amenorrhea in women. What a bummer. Contrastingly, too much luteinizing hormone may be a sign of testicular failure in men and premature menopause in women. I hope my obsession with luteinizing hormone helped you learn. I gotta go.
Fatima, are you looking that up again?
I am. Let me just tell you about it.
Fine.
ACTH stimulates the adrenal cortex to release glucocorticoids. These are needed during the stress response, so they're pretty much needed for life. So without ACTH, we'd be in big trouble. So if we have too little of it, we're going to have decreased production of glucocorticoids. And if we have too much of it, it can cause Cushing's and Addison's. Remember we learned those in patho?
Yeah.
Also, ACTH production increases in the morning and it decreases at night. So if you alter your sleep pattern, you also alter when your body releases ACTH. So let's try not to stay up too late studying tonight.
Good luck. Is that all?
One more thing, ACTH rises with acute stress.
Like the stress that we have before a medsurg test?
Well, it's more like the stress you get when you lose your house in like a hurricane. So yeah, I guess you could say it's pretty much on that level.
I'm obsessed with the anterior pituitary gland because it holds the answer to the ultimate question. What is Victoria's secret? I'll tell you. It all starts with the hypothalamus secreting thyrotropin-releasing hormone. This lets the anterior pituitary know it's time to release the big secret, thyroid-stimulating hormone, aka TSH. I'm sure you're all wondering what the big connection is between TSH and Victoria's secret to a rockin' bikini bod. Well, TSH allows the thyroid gland to produce two hormones known as T3 and T4. To sum it up, TSH is a glycoprotein responsible for controlling your body's metabolism. For instance, if your thyroid decided to secrete too much T3 and T4, the anterior pituitary would know to produce less TSH. This is known as hyperthyroidism. It could lead to health issues like Graves' disease. In contrast, hypothyroidism is when the thyroid isn't producing enough T3 and T4, signaling the production of more TSH. This could slow your metabolism down and lead to fatigue and weight gain. I think we can all agree here that the anterior pituitary is the most important gland. After all, summer is just around the corner.
Hypopituitarism can be caused by head injuries, brain tumor, brain surgery, radiation treatment, autoimmune inflammation, stroke, and infections of the brain such as meningitis. Nursing interventions. Assessment of signs and symptoms of hypo and hyperfunctioning hormone levels. Teaching compliance with hormone replacement therapy, counseling and referrals, support medical interventions, and patient teaching. Hyperpituitarism causes are hyperplasias and carcinomas, secretion by non-pituitary tumors, and certain hypothalamic disorders and carcinoid tumors.